Hello everyone, welcome back to our channel with the next topic of sole of the foot. We will continue in this video. Those who have not subscribed to our channel, do subscribe now so that you will have the continuation of gross anatomy, histology, embryology, neuroanatomy. Our channel is a complete anatomy channel, so do subscribe now. Keep watching the videos. The sole of the foot, it's an important practical question for you. The sole of the foot as such will be kept in the first MBBS practical exam or sometimes first and second layers of the sole of the foot. And it has some short notes also. We will continue with the topic. So if you dissect the skin, the thick skin of the sole of the foot, as soon as you reflect the skin of the sole of the foot, you will see the plantar aponeurosis, which is we can compare with the palmar aponeurosis you have dissected in the palm of the hand. So the deep fascia covering the sole is thickened in the center and thin at the sides. The thickened central part is called as the plantar aponeurosis, and it represents the distal part of the plantaris muscle, which is separated due to the enlargement of the heel. So this aponeurosis, if you see, it is triangular in shape. So this is the apex of the triangle and this is the base of the triangle. So this is the plantar aponeurosis. If you reflect the plantar aponeurosis, even if you don't reflect, you see on the sides two muscles of the first layer, and this is the abductor hallucis. Hallucis means going to the great toe, and this is the flexor digiti minimi. So two muscles which are on the medial and lateral sides, they are the first layer muscles. So when you reflect this central plantar aponeurosis, you will see clearly the first layer of sole of the foot, which are having three muscles. So you should remember there are 4 layers of the muscles and tendons in the sole of the foot. If you include this neurovascular bundle, some authors describe as 6 layers in the sole of the foot. So if you see in this first and third layer, they are purely muscles, and second and fourth layer consist of tendons. So that is the way to remember this 4 layers. And if you again, one way to remember is first layer extends from the calcaneum to the toes. If you see, if you move on to the third layer, they will be limited to the metatarsals to the toes. So that's the way to remember. So first layer of sole of muscle, so this is the abductor hallucis and this is the abductor digiti minimi. So two abductors and one flexor in the middle. Flexor digitorum brevis. You should have learned flexor digitorum longus in the back of the leg. So this longus is in the back of the leg and this brevis is in the first layer of the sole of the foot. So this abductor hallucis, abductor digiti minimi and flexor digitorum brevis, these 3 muscles are present in the first layer of the sole of the foot, and you can see in between the muscles. So this is the medial plantar nerve and arteries, and this is the lateral plantar nerve and arteries. So if you dissect carefully, you can see as like this in this picture, you can see in the first layer of the sole of the foot. As I used to tell, only in gross anatomy we can see whatever you are reading in the book, and it's an interesting subject in the anatomy. So you do develop interest in the gross anatomy dissection so that you will understand the gross anatomy better. So now we will not see in this video origin and insertion of all the muscles in the sole of the foot. It's a video to just to introduce the muscles to you so that you will learn in detail in the dissection. And in this video we will mainly see the plantar nerves and arteries, sometimes may be asked as essay or short notes. So you can now see clearly the origin and insertion of the first layer of the sole of the foot muscles, abductor hallucis, abductor digiti minimi and flexor digitorum brevis. So these are the 3 muscles in the first layer of the sole of the foot. So you can understand, if this has to cause abduction of the great toe, this has to be inserted in on the medial side. If this has to cause abduction of the little toe, it has to be inserted on the lateral side of the little toe. So this is again to show you clearly the plantar nerve. So this is the medial plantar nerve and this is the lateral plantar nerve. So these are the branches. These are the digital nerves because they go to the digits. Even though here we call these as toes, but the names are digital. So if it goes without dividing, then that will be called as common digital. If they divide, then that will be called as proper digital. Now in this picture you are seeing the second layer of the sole of the foot. In the second layer we are having two tendons. Flexor hallucis longus. So this is the flexor hallucis longus tendon and flexor digitorum longus tendon. So we have to remember two flexor tendons. So these muscles are in the back of the leg. Flexor hallucis longus and flexor digitorum longus. And the two muscles attached to the tendons. That's the way to remember the second layer. So what are the two muscles attached to these tendons this is the muscle attached to the flexor digitorum. So it is called flexor digitorum accessorius. Other name is this quadratus plantae. One more muscle attached to these four tendons of flexor digitorum longus is the lumbricals. So lumbricals of the foot. So these are the two tendons and two muscles attached to the tendons. So this completes the second layer of the sole of the foot. These lumbricals of hand and foot, they are the important muscles. They are the connecting muscles between the flexor tendons and extensor tendons. So that is a very important muscle for the students to learn, and you have to understand how it connects the flexor tendons and extensor tendons, so that how it acts on the metacarpophalangeal or metatarsophalangeal and interphalangeal joints. So you learn the lumbricals in detail. They are the recently evolved muscles for the skilled movements of the hand and foot. So this is the dissected picture. You can see here tendon of flexor hallucis longus going to the great toe. This is the flexor digitorum longus. Muscles attached to this is the flexor digitorum accessorius and lumbricals. So if you are dissecting the second layer after reflecting the flexor digitorum brevis muscle, that is the first layer, you are seeing the trunk of the plantar nerves also. So you can understand here. So the tibial nerve which passes under the flexor retinaculum, so that it divides into medial plantar nerve and lateral plantar nerve. So these are the trunks of the plantar nerves. You are able to see the trunks of the plantar nerves in the second layer of the sole of the foot. Even the arteries you are able to see when you reflect the second layer of the sole of the foot. Now you are seeing the third layer. Third layers are limited to the metatarsals and to the toes. So what are the third layer muscle is? Two flexors on the sides. Two flexor hallucis brevis and flexor digiti minimi brevis. In between the two flexors, adductor hallucis muscle. So in the third layer we have to remember two flexors and one adductor. In the first layer, two abductors on the sides and one flexor in the middle. In the third layer, two flexors on the sides and one adductor hallucis which has two heads, transverse head and oblique head in the middle. Now we are seeing the medial plantar artery and the lateral plantar artery very clearly in the third layer. So only muscles of the third layer. So as we have already learnt, first and third layer are purely muscles. Second and fourth layer contains the tendons and muscles. So third layer, flexor hallucis brevis muscle which has two sesamoid bones at the insertion, and this is the flexor digiti minimi brevis, And this is the adductor hallucis, which has two heads, oblique head and the transverse head. Now layer fourth layer again contain two tendons, tibialis posterior. So can you tell which compartment of leg this tibialis posterior is present? Yes, it is in the deepmost of the back of the leg. So for insertion, it is coming to the sole of the foot. And this is the peroneus longus tendon. Which compartment of leg it is present? It is present in the lateral compartment of leg. It also is inserted into the fourth layer of the sole of the foot. And the muscles are the interosseous. What interosseous here? Plantar interosseous. Dorsal interosseous on the dorsum of the foot and plantar interosseous in the sole of the foot. So we have completed the layers of the sole of the foot, and we are seeing mainly in this video plantar nerves and plantar arteries, which may be asked as short notes or as essay or as MCQs. Once the plantar nerves was asked as essay in the university exam. Medial plantar nerve. It is the larger terminal branch of the tibial nerve, accompanied by medial plantar artery on the medial side. So we have to remember arteries are running on the sides of the nerves. So that's the way to remember. So first the trunk course of the trunk of the nerve passes between the abductor hallucis and flexor digitorum brevis muscle in the first layer. Here it divides into a proper digital nerve to the medial side of the great toe and three common plantar digital nerves near the base of the metatarsals. So the trunk of the medial plantar nerve passes between the first layer is removed, abductor hallucis and flexor digitorum brevis muscle. Here it divides into the proper digital nerve to the medial side of the great toe and three common digital nerve which divides at the base of the toes. Branches of the medial plantar nerve trunk. So when it passes in between abductor hallucis and flexor digitorum brevis muscle, it is supplying these two muscles. And it is giving the digital nerve to the hallux. So that is the proper digital nerve. This gives a muscular branch to the flexor hallucis brevis also. So three muscles it has supplied. Then the common digital nerve. The first common digital nerve gives a muscular branch to the first lumbrical muscle. And the other all the digital nerves supply in addition to skin, interphalangeal joints and dorsal branches to the nail bed. So this is the medial plantar nerve we are seeing. It gives this is the trunk which divides into one proper digital nerve and three common digital nerves. So they supply the abductor hallucis. This trunk supplies the abductor hallucis and flexor digitorum brevis muscle. This proper digital nerve gives a branch to the flexor hallucis brevis. This first common digital nerve gives a muscular branch to the first lumbrical. Lateral plantar nerve, it is the smaller terminal branch of the tibial nerve, appears in the sole accompanied by the lateral plantar artery on its lateral side, passes forward laterally in between the first and second layers of the muscles. So this part supplies the flexor digitorum accessorius, that is the second layer muscle, and abductor digiti minimi, and gives cutaneous branches to the lateral margin of the sole. So this is the trunk of the lateral plantar nerve. So passes forward, then it is supplying the abductor digiti minimi muscle, first layer, and flexor digitorum accessorius in the second layer. The trunk divides into superficial and deep branches. So the superficial branch splits into two plantar nerves. The lateral one supplies, that is the skin of the lateral side of the little toe. That gives a motor branch to the flexor digiti minimi brevis and two interosseous muscles of the fourth space. The medial branch subdivides into two branches, that is common digital nerve, to supply the skin of the adjacent sides between the fourth and the little toes. Yes, now we are seeing the lateral plantar nerve, which is giving the superficial and the deep branches. So what we are seeing is the superficial, then this deep plantar nerve we will see now. Deep branch of the lateral plantar nerve. Deep branch of the lateral plantar nerve passes forward between the third and fourth layers of the sole, that is deep to the beneath the oblique head of adductor pollicis. Now if you can anyone can compare this plantar nerves with the nerves in the form of the hand. So same as the nerves in the palm of the hand. Medial plantar nerve is compared with the median nerve and lateral plantar nerve is compared with the ulnar nerve, which will divide in the palm of the hand into superficial and the deep branches. So this deep branch of lateral plantar nerve is within the concavity of the plantar arterial arch. So same comparison to the ulnar nerve. Deep branch of lateral plantar nerve supplies both heads of adductor hallucis, second to fourth lumbrical muscles, and all dorsal and plantar interossei except those in the fourth space. So this fourth space, it is supplied by the superficial branch of the lateral plantar nerve. Distribution: muscular branches from the trunk, abductor digiti and flexor digitorum accessorius branches. From the superficial branch, flexor digiti minimi brevis, third plantar and fourth dorsal interossei. From the deep branch, both heads of adductor hallucis, second to fourth lumbricals, deep dorsal and plantar interossei except those of the fourth space. So this lateral plantar nerve, even though it's a smaller terminal branch, it supplies many muscles in the sole of the foot compared to the ulnar nerve in the palm of the hand. And this medial plantar nerve is compared with the median nerve in the palm of the hand. So now we can understand. So this is the medial plantar nerve. This one diagram gives all the muscular branches. To the abductor hallucis, flexor digitorum brevis, to the flexor hallucis brevis, and this is the first lumbrical. So here is this flexor digitorum accessorius, abductor digiti minimi. So and this is the superficial, this is the deep branch and this is the superficial branch, which supplies two more muscles here. Plantar arteries. Plantar arteries, deep plantar arch may be asked as, or simply plantar arch. So that plantar arch may be asked as short notes. Medial and lateral plantar arteries, they are the terminal branches of posterior tibial artery. Medial plantar artery is the smaller branch of posterior tibial artery. It appears in the sole deep to the abductor hallucis, accompanied by the medial plantar nerve on the lateral side. So we have to remember arteries on the sides or arteries on the outer sides, nerves on the inner sides. So this is the medial plantar artery, appears deep to the abductor hallucis, accompanied by the plantar nerve on the medial side. Lateral plantar artery is the larger terminal branch of posterior tibial artery, passes between the first and second layers of the sole, so that divides into superficial and deep branches, same as ulnar artery in the palm of the hand. Superficial branches appear along the lateral intermuscular septum and anastomotic branches to join with the lateral tarsal and arcuate branches of dorsalis pedis artery. Deep branch of lateral plantar artery turns forward and medially as a continuation of the trunk beneath the oblique head of adductor hallucis. On reaching the gap between the two heads of the first dorsal interossei, anastomose with the dorsalis pedis artery, so that completing the plantar arterial arch. So this is the medial plantar artery and this is the lateral plantar artery and this is the plantar arch. Plantar arch is convex distally, so that is the situation you have to write, across the bases of the fourth, third and second metatarsal bones, and intervenes between the third and fourth layers of the sole. So this is the plantar arch. So plantar arch gives proximal perforating arteries, so that then gives the digital branches, which gives the distal perforating arteries. So these are the branches. So this is the form. This one diagram gives the formation of the arterial arch. So this is the formation of the arterial arch, so that it joins the dorsalis pedis artery. So lateral plantar artery, deep branch, passes between the third and fourth layer to join with the dorsalis pedis artery, so that it forms the plantar arch. So it's a good diagram to understand the plantar arch. It gives the branches, so they are called proximal perforating arteries. 3 proximal perforating arteries, 4 plantar metatarsal arteries. So that gives each divides into 2 plantar digital arteries. Each plantar metatarsal artery will give the distal perforating artery. So this is again the branches of the plantar arteries. So this is the medial plantar artery, and this is the lateral plantar artery, which forms the plantar arch. So in this video we have learnt in brief the muscles and tendons in the layers of the sole of the foot, and we have learnt in detail the plantar nerves and also the plantar arteries. So this plantar nerves and plantar arteries, which we have seen in detail in this video, may be asked as essay for you. Learn in detail this plantar nerves and plantar arteries. With the next topic in the lower limb, we will see in the next video. Those who have not subscribed to the channel, do subscribe now. Keep watching the videos. Thank you.